Welcome back. I hope that you enjoyed a delicious lunch in good company and that you made time to meet new people and explore the venue too. A couple of people came up to me and they said, oh, there's some people we want to speak to, but we don't know if we should because we don't know if the same rules apply here as in the US. And I said, this is what you're here for. Just go and chat. So I hope you enjoyed some good chats with people over lunch. So now it's time for our third keynote, this time on artificial intelligence, looking at the doctor-patient relationship. So please welcome from Servier, Tamara Kirchmar, and from RDS Diagnostics, Elie Lobel.
Good afternoon. Nice to see you, and it's always a challenge, as we said, to be after lunch session, but we will really try to make you feel that this is the best session of the day, isn't it, Elie?
Absolutely, Tamara.
So we will try it with a short introduction of us. So my name is Tamara Kirchmar. I work at Servier Medical Affairs. I'm responsible for the medical communication and partnership with scientific societies, and I have a pharmacology background, and I've been working for a long time in Servier on different positions. And what about you, Elie?
So I'm Elie Lobel. I'm the CEO and co-founder of RDS. RDS is a medtech startup located in Strasbourg, so in France. And so we are developing remote monitoring solution for patients, especially patients after surgery, so that we facilitate and secure early discharge from hospital. And so I will talk from the medical device point of view about the topic that we are tackling today.
So, as it was nicely introduced, yes, we are here to talk about artificial intelligence, but I would say the topic is even more important, if you allow me, because we are talking about therapeutic adherence, which is, so I will say some words about it from, let's say, more medical standpoint, because as I'm representing here more medical affair part. And it is really the time, as we say, there are some moments where we really think that it's time to act on something, and we can say today, and I will share with you some thoughts, some feedback from also, let's say, other stakeholders, why it's the time to act on therapeutic adherence. It might be not obvious for everyone what it's about, and it might seem very simple, because when we say therapeutic adherence, we think about is the patient adhering or compliant with what it was prescribed in terms of a number of pills to be taken, when to be taken, and also for how long. But it's much more complex than that, because if we think about the adherence has different, let's say, layers or different steps from the moment when something is prescribed, a drug, or also just an advice, like for lifestyle changes. Then we have a second step where we go to the pharmacy and we look for a drug, so it's a fulfillment. Then we have to go home and to be compliant with what has been prescribed, which is called compliance. And then there is another very important part, which is persistence. How long and for how long we will be able to maintain what has been recommended by a doctor. And all these steps are very important, and in order to really, I would say, measure the impact of the adherence, we have just to think about this figure, that with all the effective drugs that we have, we know the cardiovascular diseases are a first leading cause of death still, and it will be over the next 10 years, because 1 out of 2 patients is still not adhering to the treatment. So we are losing this opportunity of having effective drugs, but not having the patients who are taking these drugs. And if we could act on it, we could save lives. So that's why it's becoming a key issue. And in order to really give you I would say, the feeling of also the size of how much also the scientific societies are thinking about it, there is a clear movement from all scientific societies to make something on it at that point that they have agreed recently to create a World Adherence Day. So it was recently agreed by all scientific societies in the cardiometabolic space, and it became a clear objective to tackle the cardiovascular diseases. So this is about the adherence. But then someone might say, okay, but what can we do? So there are different things that can be done, of course, because there are different steps. There is one key, let's say, there are 2 people talking in the story. One is a patient, and one is a doctor. And then there is a whole, let's say, stakeholders around them. But where there is this famous dialogue that happens when the patient is in front of the doctor, which is really important for the adherence. If the patient doesn't feel that he received all the information that he should have received, if the patient doesn't understand why he should take this treatment, if the patient doesn't know what could be the impact of not taking the treatment, why we should expect someone to do it? So this is something that has been really understood much more recently, and there is much more attention on how we can empower the patient, how we can give them all the tools to understand better and to also be active part of this process. And on the other side, there is a doctor who also has a very difficult job, a lot of things to do in the day, and it doesn't have a lot of time. So we also have to find a way to help a doctor to find the time to have the tools that can help a doctor to improve this process. So this is a little bit kind of setting of the scene, why the adherence is important. And now we can see what can we do. And probably we will start with your experience, Ali, to tell us a little bit what you are doing to improve this adherence.
Yeah, absolutely. Thank you very much, Tamara. So I will give another dimension to the problem that you're mentioning, which is from our point of view of medical device industry, because the question of adherence is, of course, very important also for the type of medical device we are developing. So, for example, in our company, we are developing a medical device that's a monitoring device, providing the same type of information with the same quality and the same performance that you would get with a hospital monitor. And one of the first use case that we are taking off with this solution is to help facilitate and secure early hospital discharge, especially after major surgeries. So why is this important? It's because after major surgeries, so let's say digestive surgery, cardiac surgery, pulmonary surgery also, there is a risk of post-surgical complications. And because of that, surgeons are keeping the patients for several days in the hospital after surgery, mostly to monitor them. And we know that this is not optimal. It's much better for the patient to go back home early. And for example, if patients are going home earlier, let's say 48 hours after surgery, then the risk of post-surgical complication is decreased, but does not disappear. And the reason why patients are staying in the hospital is because, of course, the fear of post-surgical complications, and also the surgeons and the patient are not reassured. So with a solution like the one we develop, we provide an opportunity for enabling the patient to go back home earlier, provided the patient accepts this solution. So the question of acceptability of a medical device like this is extremely important, and I would say this is in regard with something which is called usability, which is extremely important for medical devices, to make sure that the device is easily usable by the clinicians, number one, and easily acceptable by the patient. And for example, in our case, and I think that's extremely important, by design, we took, in the way we thought of how we designed the solution, this question of acceptability into account. And of course, when you do that, it means that you need to think of the use case. What kind of patients are going to use it? In which context is it going to happen? So, for example, in our setting, it's acute care. It's not a device which is intended for chronic monitoring of patients. It's a device which is intended for high performance, acute monitoring of patients for, let's say, a week. And so the type of patients that are concerned are 60 years old, 70 years old, 80 years old. And so we took into account the fact that the solution should be extremely simple to install by the nurse, but also extremely simple to use by the patient. And in our case, for example, it's automatic, continuous. The patient can wear it continuously for 7 days, can sleep with it, can take a shower with it, doesn't need to touch any button. So it means that we made the choice of making it very simple from that point of view. And the second aspect is also how much information you're giving back to the patient. And I think that's a very tricky point. So in the solution, you have also a smartphone with an app on the smartphone. And what is the role of this app is to transmit the data from the device to the secured cloud where all the data is analyzed. The question is, shall we provide the patient with information about his heart rate, about his respiratory rate? Should we provide the patient with alerts if something is wrong or not? So that's a very tricky question. We made the choice in our design to give the patient very little information, just to know that the data is well transmitted and that the data is being looked at by clinicians. Why did we make this choice? It's because of our use case. Our use case is patients who have just undergone major surgeries. As I said, there can be 60, 70, 80 years old. We don't want them to be stressed because suddenly there is an alert on their heart rate. What is important is that they know that this data is being transmitted, that clinicians are looking at this data, and if something needs assistance, then they will take care of it. So that's really something, really important. And so that's how we worked. And the question I would like to ask you, because of course in the world of pharmacology, it's also another aspect of adherence, is how you act upon that, how you mentioned the scientific societies, how they can act upon that to improve and to make it better in this respect for the patients.
Yeah, it's a very important point, because up to some years ago it was a very silent topic, meaning it was there, but it was not really raised at the level of a real challenge. So what we noticed, for instance, in the guidelines, that recently the guidelines, for instance, I just analyzed the guidelines for angina, and I made the analysis of 5 years back, the same guidelines. The number of just the word adherence has increased 6 times in the guidelines, and they are proposing now solutions. So it means that they acknowledge the fact that it's an issue, and they are proposing solutions. So which solutions? So your case is really interesting, but it's in a particular setting, in a very acute phase, where of course most of the death happens. It's really important, but it's an interesting also other case, which is the chronic patient, which is a big issue today, because we know that with the very high level of treatments that we are providing, we have patients and a population that is aging with a lot of treatments and a lot of comorbidities. So they are living longer, but they are living longer with a lot of pills to be taken every day. So this is this famous concept of multimorbidity and multi-pills, which is a big issue. So there are different solutions for that. We are, let's say, trying to work on different parts and to give a kind of integrated solutions. One of these is to see how we can help patients to be better self-monitored. So that's why we partnered with a startup company who developed an application which is allowing patients to be better self-monitored and at the end of the day to improve the adherence. And within this application they are applying the artificial intelligence for the sessions of coaching of the patient. So what came out from the analysis we are doing now for among more than 200,000 patients that are using the application is that those, of course, who are regularly using the coaching sessions are those who have better results, which is obvious because they are, of course, even more, I would say, encouraged to be in a better self-monitoring mindset. So this is one type of solution. So to provide to the patient digital tools, particularly if powered with the AI, that can allow them also to be adapted to their to their profiles, because not each patient is the same, because probably I need information that you might not need, or I'm more, let's say, worried about things that you are not worried at all, which is normal because we are different human beings, and adherence is a question of all behavior as well. So this is really important. That's why the place of AI in this process is really key. But on the other side, we have to do something also at the level of scientific societies, meaning they have to do in order to really make doctors recognize the issue, and this will then trigger other actions. So there will be more for education on that, there will be more discussion about that during the congresses, which was not the case before. And then there are, of course, other solutions, so simplifying the treatment, providing more, let's say, treatment which have inside multiple pills. So there are many, many solutions that, of course, has to be taken into account and has to be implemented in a kind of coordinated way, not just one spot, one application, but it really has to be a coordinated movement between all stakeholders that are really involved.
So if I can bounce on what you're saying, and I think in what you're mentioning, the doctor-patient relationship is also extremely important, and that's very interesting because we see that in the use case that I have mentioned, that patients sometimes, that's something very interesting. The company is based in Strasbourg, and I was discussing with a cardiac surgeon, and he was telling me that something special about the patient that he has to deal with is that they don't want to disturb the clinician. So if something is happening when they are at home, they will not call until the last minute when the situation is really very bad. And so the importance of the doctor-patient relationship is absolutely crucial. And for example, when we are proposing such a solution, so to the patient, meaning that the clinician is saying, okay, you can go out of the hospital a little bit sooner than otherwise, and we will monitor you thanks to this wearable that you will wear on the back. You can keep it all the time, it's comfortable, you can sleep with it, you can take your shower with it. You will have to carry a smartphone with you so that we transmit the data, and we will look at the data. And we find out that if the doctor is convinced about that, then the patient will be reassured. So that's something very important. And also to talk about AI, because it's an element of the conference today. We have an approach which is, of course, related to our use case of acute care. So we're talking about acute care patients. And this device is gathering a lot of data about the patient because it's working continuously, 24 hours a day. We get heart rate, respiratory rate, oxygen saturation, temperature every second. So we have a huge amount of data. The nice thing about this solution is that it's very easy to wear. So we are discussing with anesthesiologists who are saying it would be interesting to have the patient wear this before the surgery so that we can gather for several days in real conditions. So I mean when the patient is going back home, going into his daily life, his personalized model of normality. Because today, without this, when we are looking at the data after the surgery, we have to use statistical model of normality to say, for example, if the heart rate is in a normal range or not, or if the respiratory rate is in a normal range or not. However, you know it very well. My heart rate at rest and your heart rate at rest can be very different. I mean, somebody very sportive will have a low heart rate at rest, and somebody less sportive will have. So having a statistical model of normality is good, but it's not the best. And the nice thing with that is that we can gather so much data that we can have a personalized model of normality. And then when the patient is wearing the device again after the surgery, or maybe can keep it all along, we can analyze this data in comparison with his personalized model of normality, which means that we are much more capable of finding subtle abnormality that happen that you would not detect because maybe in you it would be normal, but in me it's not normal. And if you compare it with my individual personal model, then you find out that it's abnormal.
It's very interesting because you are, let's say, tackling the point from the point of view of more technology side, but also when we think about why this artificial intelligence is key for the adherence story, I think, is because at the end of the day, the adherence is also about the communication. And this is what is missing, because between not always there is a time, not all information always received by the patient. I will always remember the story of this patient person who told me the story that he came out from the hospital after an MI, luckily everything went well, and he got the list of 10 treatments, a short description what happened, of course half of that he didn't really understand, and then he went home. And then he told me what I did, first thing that I did, I was looking for someone who will be in my family, either a doctor or a pharmacist, to ask what does it mean, why should I take this treatment, if I don't take the treatment today, what should I do? All these kind of questions that an artificial intelligence can answer. Of course it has to be very, very well, I would say, controlled and extremely precise, because it's an important topic that we are treating here. But it's something that can help probably this lack of time that is a fact, we cannot deny it, and this need, which is a very human need, to have information to understand better and in order to comply and in order to be adherent to something. So I think we are at the beginning of the story of artificial intelligence within therapeutic adherence topic, but we are a pioneer in that sense, because with this project that we have with this application, we are seeing some first interesting results. But we are gathering data, we will publish probably, so it is something that is, meaning it's the beginning of the story, and it's a really interesting and very passionate story. But what is super interesting is that we are kind of in the global movement, and we see that it is something that really matters.
We'll stop it here, and thank you very much, Tamara.
It was a pleasure.